my research interests are in men's health. Do you know how hard it is to find a physician who aligns with that philosophy? I mean, it is. I have been to the emergency department, the family medicine department, neurology, dermatology. I mean, there are studies that exist that posit such terrible things about men's health. You know, we talk about 2.6 to 1 ratio of women to men after the age of 85 because the men are dying. We talk about this 7-year age gap or 6.5, whatever it is. We talk about this male isolation epidemic. The Surgeon General declares in 2023 this very, this thing that acutely affects men. And yet here we are talking about, well, there's no mentors in medicine who are, our men's health club at the University of Cincinnati College of Medicine was axed last year, unfortunately. And I imagine that's just because of a lack of interest, which is just, man. But I will say that work, men's work, still finds its way into medicine. And if you still question my gratitude, I'll give you an example. So a few weeks before school ended, and I'm telling this story with her permission, a classmate of mine came up to me and just started like spouting all of this information. And she was telling me a story of how she was sexually harassed by somebody at the hospital. And I guess that's as much detail as I'll go into about that. But I was able to, because of the precedent, the emotional precedent set by men like yourself, I was able to listen. And instead of assuming what she wanted, instead of acting aggressively, whatever, I just listened. I said, well, how can I be here for you right now? And we walked down together. We went directly to student affairs. We reported it. And now she feels safer. She feels like she can go places that she hasn't gone. I'm sharing this with her permission. I'm very excited about that. I mean, it's things like that I owe to people like you, frankly. I wouldn't have the emotional tools and skills if not for men like you setting the precedent early.
Well, I appreciate you. And I thank you for those words. I think that you're actually taking those things and putting it into action